Let us say a very warm welcome to Jamie Jenkins without further ado. Jamie, how are you doing?
Good morning, Mike. The sun is shining. I think, if you're coming on the road, come over to Wales as well. It'd be good to...
Well, I don't know if your man Drakeford will let us in without some kind of fee. You know, it might be some kind of, a carrying fee or something.
Well, I've been reading this morning that the Welsh Government are refusing to rule out keeping some of the restrictions in this Friday. They were supposed to be coming to an end, but I think Sturgeon's keeping some of the masks in. So Mark Drakeford's bound to continue with something, Mike.
He likes the restrictions, doesn't he, old Drakeford? I mean, he can't be having his government run without it.
No, and yesterday he was saying that he'd welcome a Ukrainian refugee into his home as well. And, obviously it's tragic.
Haven't they suffered enough, as they say?
Well, yeah, and Nicola Sturgeon said the same in 2015 with the Syrian refugees, but I don't think she ever did house the Syrian refugees. It's probably just some kind of virtue signalling from the First Minister again.
Absolutely right. Now, there's lots to talk about today, Jamie. So we kick off with the excess death stats that came out fresh this morning, 9:30. Tell us what they said.
Yeah, so excess deaths, just for the viewers and listeners, just to explain what they are, is that, mortality doesn't generally change much year to year. We get improvements over the long period of time. So what you do, Mike, is you look at how many deaths occur in the population, and then you can compare it to, say, an average over the years previously. And we've seen this big excess deaths because of COVID in those big waves that we had in March and then last winter. But what the ONS have done this morning, they published looking at a lot of the excess deaths that were not COVID related. So we know that people have been dying of COVID, but there's other causes of death, and we've talked about it in the show. And some really sad, tragic numbers in there, Mike, because if you start looking at, say, younger people aged 1 to 19, then they've published and looked at it. We're talking small numbers now, because remember, people generally don't die in their 1 to 19 as well. That's which is the thing. But the most common causes of excess deaths, tragically, was excess suicides, accidental poisoning. Sometimes that's where you can't determine if it was a suicide or not, and somebody may have poisoned themselves purposely or not. So the intent is unsure. And homicides, where we could be talking about kind of murders that have been going on, and then they're about 26 above average, which, depending on the different causes, about 12 to 20% above average, which is just tragic, Mike, when you start looking at the impact of obviously all these different lockdowns, and we talk about COVID and the impact on young people generally being low in terms of death, but we've seen these excess deaths. And if you look at older people, Mike, about 50 to 79-year-olds, we've seen excess deaths from heart disease, and that might be because they haven't come forward for healthcare over the pandemic. So some tragic stories out there, Mike, and I think in the fullness of time, we're probably going to continue to see these, because cancer waiting times in the NHS have gone through the roof, and they're the worst on record.
Absolutely. And as far as the way that all of these figures have been collated over time, we're seeing more and more studies, aren't we, Jamie, that say, actually, maybe there were a few flaws in the way that some of these statistics were collected, not just excess deaths, but not just COVID-related, but everything, really.
Yeah, so if you start looking at the death figures overall, I think the biggest things to point out, Mike, is we started publishing every day the number of deaths within 28 days of a positive test. At the start of the pandemic, we weren't testing many people, so it was actually an undercount, that figure. But as we've gone over time, and you start looking, say, through the Omicron wave now, Mike, so many people have it. If you tested positive in the last month and then you get hit by a bus, you'd be included in those figures, and we can clearly see they're not fit for purpose at the moment. If you start looking at the figures with death certificates, Mike, we're about 185,000 overall. Now, I think some of the critics, which was in a Daily Mail article on the weekend, were saying that some of the appointments were being done over kind of video conference. So there may have been some mislabeling of some of the deaths. But you can take all of that out and start looking at the excess deaths. And they're currently running at around 147,000. They will include some of those deaths that we just talked about, Mike, which are non-COVID excess as well. But it's quite clear there has been a huge number of COVID deaths over the pandemic. It may not be as high as 185,000. It may be lower.
I think it's
than
definitely not. It's definitely not 185,000, is it? I think we can say that.
And if you take the excess deaths of 147,000, Mike, and take some off for some of the other causes, it's probably not going to be as high as what the actual figures have been reported. And ultimately, I think that the important thing really as we move forward, Mike, the inquiry we'll look into a bit more detail on that. The excess deaths at the moment are below average, and they have been for the last couple of months. So we're actually in a good position when it comes to the COVID situation across the country.
Yes, I think that's absolutely right. And, you know, as far as the inquiry goes that's coming up, you know, we would like to think that there will be some proper questions asked and there will be some proper analysis done. But unfortunately, it doesn't begin to look like that, does it? They're talking about not even taking into account the effect that the lockdowns may have had on children. We've already got people now admitting, who didn't admit it before, that we were right all along when we said this is terribly damaging to kids, not letting them go to school, making them wear masks when they do go back, making them scared of infecting their elderly relatives with COVID and letting them die. I mean, it was horrendous.
Yeah, well, Nadeem Zahawi was coming out the other day saying you don't need an inquiry to say it was a mistake for stopping children going to school. Mark Drakeford in Wales won't have a Welsh-specific inquiry, even though he's kind of explained how important it is for the Welsh government to run COVID policies in Wales. And I think, you know, the inquiry, why is it taking so long to start as well, Mike? You know, and are we going to get the Met Police doing the inquiry? Because it might take about 10 years to get the actual results of it when you start looking at it all. So I think an inquiry is badly needed, because we may have another pandemic in the next kind of few years or not. Who knows? It's unlikely, Mike, because there seems to be a 1 in 100-year event. But we've got to learn the lessons. Then we can't go into this knee-jerk reaction of just following every other country into lockdowns and doing the same mistakes over and over again. Yeah. You work out what worked well and what didn't.
But that's the thing, isn't it? People say, oh, but when we were making these restrictions possible and when we were making it safer for people to live and safeguarding lives and safeguarding the NHS, we were only doing what every other country was doing. But the one thing we were not doing like every other country was counting, because every other country counted their deaths differently. And we ended up becoming the pariah of Europe at one point, I seem to remember, because Boris Johnson insisted on telling everybody how many people were dying every day.
Well, that was in part to do with those COVID deaths within 28 days of a test. And remember, Mike, people were talking about COVID cases in the UK at record levels because we were testing far more than most of Europe. And again, that's had a damaging effect on the economy because few people were coming in. It's good to see that, you know, we're removing a lot of these restrictions across the country, and England's obviously got rid of them all. And we've got to move forward now, Mike, to try and get the economy, because we've gone from a COVID crisis into a cost of living crisis, and we can touch on kind of the economic factors at the moment ahead of the budget tomorrow. And I think that the thing is, Mike, the NHS really does need to start coming back and getting back to work properly, because even in the latest figures, Mike, I know there's a lot of pressure from the health secretary back end of last year for face-to-face appointments, but GP appointments is still well down in terms of face-to-face appointments. They're currently 60% in January. You know, it was over 80% before the pandemic. And why aren't people still not able to see a GP face-to-face? And on those cancer figures I give you, Mike, if people do get a referral, the target is to get 93% of people who would need an urgent referral because they're suspected of cancer, 93% within 2 weeks. And the latest figures, it was 75%, you know, so people, even if they are getting to see somebody, they're not getting to see somebody after that to get that urgent look in terms of have you got cancer or not.
No. And there's still plenty of parts of the NHS that are not back to normal. I mean, we hear this all the time. You know, I got a tweet today from a friend, from somebody on Twitter rather, saying that his son and daughter are being forced to pay £30. They both work in the NHS, being forced to pay £30 for parking every day because apparently the charges are now being passed on to the workers. Now, that you can say is nothing to do with the NHS, but it is to do with the NHS because they allow these private parking companies to come in and run hospital car parks.
Well, yeah, and that's generally a pay cut then, isn't it, for the NHS? We're having to do that. I know there's been a lot of discussion around parking, and I think my partner works in the NHS, Mike. She's had to pay for parking in the past. I think they scrapped all the fees now in Wales for some of the car
I think they
parks.
did that in Scotland as well, but unfortunately they didn't do it in England. But the bottom line is that they're still hiring loads of people with money that they say they haven't got to do jobs that are not required.
No, and managers as well, Mike. We've talked about this in the past. The layers of management in the NHS, you know, it does need that overhaul. It does need to look at in terms of what it's doing, because, you know, the money is not a bottomless pit of money. If you start looking at the finances, the public finances, Mike, they're absolutely all over the place. And the Chancellor's going to have to find a few rabbits in the hat tomorrow for all these poor families out there who are going to be struggling over the next kind of 5 to 10 years.
But that is exactly the point, isn't it? Because it's almost impossible to make a spring budget statement that makes any sense, given what we don't know.
No, I think an important figure, Mike, actually, is we talk about the national insurance rise that's going to come in April. Is going to raise about £12 billion a year. Now, in February alone, we spent £8.2 billion on the debt interest for this country. So we've got this massive, massive debt that we've accumulated over the last few centuries. Obviously, COVID has added a lot to that. And we spent £67 billion on the national debt, just servicing the interest payments since last April. And the borrowing in February alone was another 13 billion. So the money that he's talking about raising to go towards the NHS throughout the whole of the year, the £12 billion from the the national insurance increase, well, we spent that practically in 1 month, Mike. So I think the important thing really is just looking at not just at the headline macroeconomic figures. I've been crunching some of the numbers, Mike. If you start looking at housing costs, food, transport, all of that, people with the lowest incomes in this country spend 52% of their incomes on those things. And those are the things that are going way out of control. The top 10% spend 39%. So obviously they spend probably a little bit more because they've got bigger houses, but disproportionately, this kind of fuel crisis and energy crisis is hitting the poorest families. And something's got to give, Mike. Something's got to give.
Well, it does have to, doesn't it? And this is why, 5% or 5p off a litre of petrol is not really going to cut it. It doesn't sound as though the noises coming out of Downing Street are that he's going to not put this national insurance rate up. But what he might do, according to John Rentoul, who I was talking to earlier, is he might change the thresholds for tax in a way so that at least some of those people on lower incomes won't be paying more in national insurance until they reach a certain level.
And that would be helpful, Mike. But again, what it does is if you start cutting taxes, we do need to look at the whole financial balance sheet overall. We kind of kicked it down the long grass because of COVID, and we're probably going to have to do the same. But at some point in time, there comes that position where it's going to bite, and we're going to have to kind of look at, because if you think 67 billion since last April on just paying off the debt, that's dead money, really, Mike. That's just going to people. And what's causing the inflation that we're seeing at the moment is making those kind of interest payments go up, because a lot of the government borrowing, Mike, is linked to inflation. So when inflation's quite high, we start paying even more to the people we've been borrowing money off. So it's a bit of a catch-22 situation, because the debt starts going up, so then we need to borrow more money, and then that goes up even more.
Yeah, absolutely right. Stay with us, Jamie. Got a couple of things to talk to you about from the other side of the Atlantic. The CDC in particular, they've adjusted their COVID-19 deaths as well. We'll find out what that's all about. We're talking to Jamie Jenkins, of course. He is our favourite statistician. We'll take your calls, of course, as well. 0344 499 1000. Rishi Sunak making a massive announcement this week. It could make you richer, it could make you poorer. Whatever happens, though, you might want to hear it right here on Talk Radio.
Talk Radio. Rev it up, roar it out.
The voice of the people.
The home of common sense.
Solid state human debate on a digital platform.
Radio that stands to reason.
Listen and learn.
Talk Radio.
Welcome back to the Independent Republican, Mike Graham, right here on Talk Radio. We are going to be talking to Kevin O'Sullivan coming up in a little while. He's on tonight from 7, of course. We've got a couple of things to sort out with him. Jamie Jenkins is also here. We're talking to him about the problem with the numbers that were being counted during the pandemic, COVID deaths specifically. Jamie, I wanted to mention to you this story that's come out of the US today. The US Centers for Disease Control and Prevention, the CDC, they apparently slashed their reported number of child COVID-19 deaths by nearly 25%. Without any proper explanation. What's all that about?
Yeah, it's bizarre, Mike. They said it was a coding error, apparently, it doesn't give you confidence, obviously, because they would be what you would class as the Office for National Statistics in the UK. So it's an important institution. And child COVID deaths are quite topical at the moment, because obviously across the country we're starting to see letters landing for parents for vaccinations for 5 to 11-year-olds, and not only of kind of the figures there being kind of wrong because of the miscoding and then being brought back down. If we look within our country, Mike, a couple of months back, NHS England put a tweet out from one of their doctors talking about some child COVID deaths. They had to delete the tweet because they were overinflating the number of numbers in there, and they read somebody's online blog where they got the numbers, I think, and actually they're far lower than what you would imagine. And And the thing is, I had a letter actually from the Welsh government for my children, 5 to 11-year-olds, to have the vaccine. And, personal choice of the parents. They should, I think the JCVI statement's quite clear on this, Mike, that parents need kind of informed consent, as in to really understand the numbers. The letter didn't quote hardly any statistics in there, Mike, which was quite concerning to me, because how can you make an informed choice if you don't know? And the JCVI statement itself, which was released a couple of weeks back on this, said that you'd need to vaccinate 2 million children, or 4 million doses, to prevent one child. This is just one child, Mike, 4 million doses, to prevent one child going into ICU. So it's quite topical, the issue around the child COVID deaths. They are very rare. Even the JCVI statement themselves said serious impact of COVID on children is pretty rare, and about 85% they estimate would have had COVID by the end of January, and the JCVI said that will offer them some immunity. So I think parents out there, if they are getting these letters, really need to start looking at the facts and figures to make an informed decision. I personally won't be vaccinating my children, but it's not for me to obviously tell people what to do.
No, listen, that's always been my position as well. Listen, you do what you want. If you want to vaccinate your children, ask them if they want to be vaccinated, would be my suggestion. And if they do, then that's up to you. It's your family. But it's certainly not something I'm going to be advocating for my own family. But let's talk about the way that this is still being kind of kept going, if you like, because I still hear doctors, who are on the face of it supposed to be representative of the medical profession, saying that, we've got this new Delta variant coming in, Delta Crom they're calling it, it's not really very harmful compared to the original Delta, but it could still put lots of people in hospital, and we must be careful that we don't overwhelm the NHS. I mean, if these people got no shame, they're trotting out the same old cobblers that they trotted out the last time when things were a lot worse, and I find it completely and utterly irresponsible.
No, Mike, it's the same people who've been kind of scaring the public over the last 2 years. Now, the COVID figures are going up at the moment, but let me just explain kind of what's driving that. It's not really a surprise either, because I think when they were rolling out the booster vaccine a few months back, even Chris Whitty, I think, and others were saying that the evidence suggests that it's only going to last about 10 to 12 weeks. And we're about 10 to 12 weeks on from that. And whilst the vaccines don't stop you catching COVID, it's quite clear. I know more people with COVID now. They're not, and none of them are really ill, Mike, than ever, really. But the COVID vaccine doesn't stop you catching it. It does reduce it. So what we're seeing now is the vaccine's waning, and more and more people are catching it. But the important thing is, when you start looking in the headlines, and I've seen other broadcasters putting out some scare stories. I think Scotland's got the most number of people in hospital since the pandemic started. It's that...
Yeah, but they don't tell you what the number is. They just say things like that, and you go, well, I don't know what that means.
Yeah, but the important thing is, Mike, these are patients with COVID, not specifically being in hospital because of COVID. If we look underneath the headline figures, because obviously everybody's getting tested, Mike. If everybody in the UK today had Omicron, then everybody in hospital would have Omicron, but it doesn't necessarily mean they're in for it.
Right.
The figures that aren't moving at all are the number of patients in critical care, so it's not causing any more kind of deadliness in terms of it. And about 60% of the patients overall, Mike, who are going in the hospital are going in with other things, but they're just having to test positive, or some of them are catching it in hospital when they're in there. So there's always going to be that element of people across the country, because some people have made a kind of a living, an industry out of scaring the public over the last 2 years. They don't want to let go, Mike.
No.
I'd rather come on the show and start talking to you the next few months over all, the recovery and the economic facts of what's going on, rather than people doom glooming about COVID, because it's not going anywhere, Mike. Flu never went away when we got it 100 years ago. Boris is right. We've got to learn to live with this now. Crack on.
Absolutely right. Crack on indeed, Jamie. We'll speak to you again soon, hopefully about the economy.